Hello everyone, my name is Tigui Sarkisian and I'm the founder of Simple Steps Fertility, egg donor and surrogacy agency. We're also an infertility support center. Today I would like to speak to anybody who's interested in becoming an egg donor. Egg donors must be female. They must be from the ages of 21 to 29 in very healthy condition. General health must be healthy, their fertility potential must be healthy, they must be non-smokers and not use any drugs. If you are one of those many females that are interested in becoming an egg donor, then I would like to review the process with you. The journey begins with a simple click on our website to conduct a pre-screen application with just a few questions to make sure that you are truly a candidate for egg donation. The first step in becoming an egg donor is visiting a reproductive endocrinologist for a medical screen. During that appointment, you are asked to have some blood drawn for infectious disease. You are also instructed to have a pelvic ultrasound. The pelvic ultrasound is done to look at the ovaries and have a follicle count to make sure that your ovaries are healthy enough. A follicle is a fluid-filled sac with an egg inside, and every woman has many of these follicles at birth. With puberty and life in general, we lose hundreds of eggs every month. With this ultrasound, we can take a look at the volume of the ovary and count the follicles to make sure that it is enough to be an egg donor. The next step after the medical screen is to have a genetic screen. All egg donors give a little bit of blood to have a carrier testing done. A carrier testing is a test that looks at about 280 autosomal recessive diseases. What this means is that if you are a carrier of a mutation, we have to make sure that the sperm donor does not have the same mutation. It is a genetic screen. It's actually very interesting to know, and it's very helpful to plan for your own future when you're ready to start a family. The genetic information can be kept anonymous, and it can be kept where you don't have to know the results, but it is always interesting to share. The next step is to have a psychological evaluation. We want to make sure that both your physical and mental health are optimal. We want to make sure that as you make this decision to become an egg donor, we properly screen you to make sure that you do not have any adverse effects. During your psychological evaluation, we want to make sure that you understand what the process is, that you are ready for the process, and that you are not suffering from any depression or anxiety or any other psychological disorder. If you pass your psychological evaluation, the next step is to meet with an attorney. The attorney will review all documents and contract to ensure that all the documents that you are signing, you understand and you are in full agreement. We want to make sure you completely understand the process and that you are donating your eggs to the family that will be the legal guardians of those eggs, and they will be the ones to decide what happens. Once the legal contracts are signed, we will move on to starting medication. The medication that you will be taking are these very thin needles. They're injectables that you may take once or twice a day for about 10 days. After 10 days, there is a procedure called an egg retrieval that is done to retrieve the eggs. This procedure requires a short amount of anesthesia. You will be recovering in an outpatient surgical center for about an hour, and you'll be able to go home the same day. Our 24-hour nursing staff and also the reproductive endocrinologist and his staff will be monitoring you to make sure that you are okay and have a follow-up appointment to ensure that the cycle went well. The medications that you take are very short-acting, and you will get your period about 2 weeks after the egg retrieval. There are some complications that are associated with egg donation, which include hyperstimulation, that will be discussed with you in detail when you meet with your clinical coordinator. Please do not hesitate asking any questions to make sure that you are understanding and feel that the process is safe. The egg donor actually goes through the same process as a woman that is trying to get pregnant, but you never have an embryo that is transferred back in. That is where the intended mother comes in. The most important part of egg donation that I want to point out is that you will never be losing any eggs that you would have used in the future for your own family, or just in the future if you are curious about that. Every woman loses hundreds of eggs every month. And with the use of the medication, we're able to catch some of them, hopefully about 10 to 20 of them. This is an ideal number for an egg donor. We're not trying to take too many, we're just trying to take enough to help the intended parents conceive and have a family of their own. The egg donors are also taken care of until they are back to their normal health and able to continue life as they started. If you're interested in being an egg donor, please don't hesitate to join us. Please go to our website at www.simplestepsfertility.com and click on the survey and begin the questionnaire. We're happy to help you. We have a full staff of 15 years of experience and a 24-hour on-call nurse that is there to help you with this process. Have a wonderful day. Thank you.